Renuvion and Profound are very different devices. They're both radio frequency. They deliver the radio frequency energy very differently. As we know, Renuvion is plasma-based and it's more invasive. Profound is less invasive, but still somewhat invasive. You still have to numb and you're still penetrating the skin. I guess the biggest difference is Renuvion has to be done, I would say it has to be done by a surgeon or at least, someone who's very well trained that way, like say an NP or a PA who's very well trained in a lipo type of thing, whereas Profound can be done by an RN or up. The risk of causing a major problem with Profound is less, just because the risk of penetrating something, causing damage to some other structure because you don't know your anatomy is far, far less. Both take some skill, both take some training. And you need someone who's really going to focus and pay attention. And neither one is completely devoid of risk, of course, but Profound is definitely has less risk just because it's less invasive. The two are also different in terms of which layer they're treating. Renuvion is treating the deep plane for the most part, and Profound is treating the more superficial plane, not the most superficial, not the epidermis, but the deep dermis. The deep dermis is going to cause, treating that plane will cause remodeling of the deep dermis, some tightening, new elastin, which is something that Profound really can shout about and really should. Renuvion, I don't think there's any data to support elastin. We're not really trying to improve elastin. We're trying to improve collagen in the fibrous septate to shrink everything down. The nice thing about these two devices is because they're different enough and because they're different planes, you can actually do them at the same time with essentially no risk, or very, very little risk. Nothing's no risk. So you can, what I would do is I would either do one or the other first. I don't think it makes a difference, but I would treat the skin, of course, with Profound and then Renuvion, the deep plate, at the same time. And the two should work together to give you a better result than the sum of the parts.